got a big interview right now. Let's say good morning to Dr. Bob England, the interim director of the Pima County Health Department. Dr. Bob, how are you, sir?
I'm good. Good morning.
Good morning.
So you're just loafing around doing nothing these days, right?
Nobody wants to talk to you.
Oh yeah. We're in the 20-hour workday mode.
Yeah. Well, we appreciate you giving us a few minutes this morning. Can you give us a quick status of what the COVID-19? What are we looking at here in Pima County? What do folks in Tucson need to be? How concerned do they need to be, and what steps should we be taking?
Okay, so this is not going to be good at all, but it's not going to be quite as terrifying as the headlines might lead you to believe. We need to take this seriously. It's either here circulating now or it will be soon, so start right now focusing on the things you can do to protect yourself and the people around you. Hand washing is number one. It sounds trite, but that's for real. Try to keep your hands away from your face. Biggest thing to do is if you feel sick, even if you think it's just a little cold, stay away from other people, especially people who are most vulnerable. And those are older adults, people with chronic lung disease, heart disease, diabetes, and so forth. This is the reason I say we don't think it's going to be as big as the headlines would indicate, is that the people getting tested almost everywhere are people who are the sickest. So once there's enough testing available for us to really understand what's going on, we're going to find more and more and more people with mild illness. But even if your illness is mild, you could give it to someone who gives it to someone who gives it to someone who gets into serious trouble. So let's take care of each other right now and take those common sense precautions to stay safe.
Isn't this likely to also help contain just the regular strains of flu that are going around right now?
Absolutely. This is the same stuff we say every year, and maybe this year people will pay more attention to it. So the flu is a big deal. A couple years ago, we had a particularly bad flu season, but it was just regular seasonal flu, and it probably killed a couple of hundred people here in Pima County.
But we didn't hear anything about it.
I know. So the difference is you're going to hear every day an update in the news. How many people have tested positive? How many deaths have we had? If we had treated flu that way any year, even this year, people would be really scared. So part of the fear is that this is new and we really do have things to learn. Part of the fear is that it's just right in our face all the time. We can do stuff to try to protect ourselves. Biggest thing, if you're at all sick, this is a really bad time to go visit grandma. Okay? Don't be around people who are at serious risk, and stay home if you're sick. Don't think you're so important you have to go to work. Don't send your kids to school if they're sick. Interestingly, school kids are the ones we have to worry about the least. It seems that kids are getting infected less often and transmit the disease less than adults do, and I have no explanation for that. That's the reverse of what usually happens, but I'll take it. That's a very good thing.
Yeah. We're talking to Dr. Bob England, who is the interim director of Pima County Health Department. Can you? I know you can't give us, any specifics of who these folks are that have been diagnosed here in town, but how are they doing? I'm sure they're being watched and observed very closely.
We've only had one individual test positive in our county, and that person completely recovered. Okay. Was never hospitalized, spent the duration at home. So just as we expect the vast majority of infections to be mild, that's what we've seen. But having said that, we're only testing people who are sick and have a direct reason to suspect this might be it, like contact to somebody else who had it or traveled to one of the places where it's spreading a lot. And so we're not going to pick up the first several cases of community transmission this way. We need more testing to understand what's going on, but we need to treat it like it's here right now.
Dr. Bob, is there a difference between washing your hands and using hand sanitizer? I was talking to somebody last night about that, and I was wondering, is there a difference? Is one better than the other, or should you should at least do one?
Yeah.
I'm just wondering,
if you can, wash your hands. And that means thoroughly wash your hands, 20 seconds or so. I can't stand it in public restrooms watching people go to the sink and flick their fingers through the water for a couple seconds like it's holy water or something. It's going to disinfect them. You're scrubbing the germs off your hands. Hand sanitizer is a close second if you've got it, and if you use that well, rub it around a lot until it dries.
Okay. Dr. Bob, is there a website that we can refer people to get kind of ongoing information and any updates that you guys might have?
Absolutely. Go to ours, Pima County's. It's pima.gov/COVID-19. The same way you see it written all the time in the press.
Okay.
Pima.gov/COVID-19. That links to all kinds of other stuff, so that'll get you to the state or the federal website if you'd like.
Okay. Outstanding. Well, we'll share that on our social media and see if we can get the word out there. Please update us, give us a call, let us know if there's anything else that we can do to help to spread the word on this, and not the panic. Only the positive things.
Right.
You bet. Pay attention. This is changing all the time, and we're trying to find that balance between not disrupting our lives too much, but doing what we need to minimize this.
All right. The Interim Director of Pima County Health Department, Dr. Bob England. Thank you so much for giving us some time this morning, Dr. Bob.
You betcha. Thank you, guys.